way that I've been feeling now reminds me of a couple of years ago when I was really, really feeling down. And I didn't ask for help. Things are even worse now.
So, what do you suppose we should do about this?
I should call Dr. Crocker and request an appointment with him.
Paul receives his primary care from a patient-centered medical home, which is a new team-based care model where the physician is not the only one available to help patients. Many primary care practices are moving to this model because it enables faster access to needed services and also coordinates those services.
Hi, Paul. This is Martha from the ambulatory practice. We got your message and we know that you're not feeling great. We checked Dr. Crocker's schedule and he doesn't have any availability for the next 3 days. But we know you're not feeling great, and Jane Matthew-Lee, our nurse practitioner, does have time this afternoon at 3:30 if that works for you.
Patient-centered medical home care teams include many clinicians embedded within the practice and are tightly linked to specialists so they are readily accessible to patients. For example, Paul's practice has doctors, nurse practitioners, registered nurses, health and wellness coaches, and medical assistants.
The patient-centered medical home is a model of care that is very team-oriented, that provides a new level of access to patients and a method of patients being able to communicate and stay in touch with their team, and relies on more than just the physician to provide that level of care. The benefits that we see immediately are that patients get to know their family of care providers. They can often receive care in a single setting as opposed to having their care parsed out across multiple specialty groups. What we see is an immense improvement over the old model of care, which really relied solely on the interaction between physician or clinician and patient. Now we have a team really there to support that patient, and what we're seeing with that is that patients are becoming more invested and engaged in their own care.
Within 1 day of contacting his patient-centered medical home, Paul is seen, first by a medical assistant to be screened for depression, a standard procedure, then by a nurse practitioner who reviews the screening results and is able to recommend a quick next step.
Based on what we've talked about, I'm thinking that maybe you could benefit by a program that we have at the Ambulatory Practice of the Future called the Depression Collaborative Program. And our health coach, Ryan, is the person who runs this program, and I think he might be really helpful for you.
At this practice, a health coach is available to help patients achieve personalized health goals and to meet regularly, in person or by virtual visit, to educate, support, guide, and track progress.
How did everything go for you?
Yeah, interestingly enough, it gave me the opportunity to show myself that I could get it done, and I could get it done well.
Under the old system, Paul would still be waiting to see me and likely feeling worse each day. Now with the coordinated care that we can provide him and the option of working with a health and wellness coach, he already has a plan in place, and his condition is likely to be improving by the next time I see him. As his primary care physician, I'm kept in the loop regarding his care, as is the entire care team. Collaboration is vigorous, routine, and supported by robust technology. The difference for patients and as well as providers is you have an opportunity to really connect with another person. You're not necessarily connecting with a task or a disease or an illness, you're connecting with people. And being able to connect with people is, I think, one of the first steps in getting them engaged in caring about their own illness and their own wellness.